Hi, I'm Tony Nichols, and welcome to Chamber Chat. Hi, I'm Tony Nichols, and welcome to Chamber Chat, a program put together by the Salisbury Area Chamber of Commerce to keep you informed on what's going on in your chamber and in your community. Joining us now on Chamber Chat is Joe Tabeling, Senior Associate with CQI and Associates. Welcome to the program.
Welcome. Thank you. Thank you. Appreciate it.
So CQI is an acronym we haven't heard a lot about around these parts. Why don't you tell us who and what CQI is?
Well, CQI is a locally, I say locally, meaning Maryland, owned, family-operated, nationally recognized energy management and consulting firm. Been around since 1995.
Okay.
And anything dealing in energy, is in that full umbrella is what we do.
All right, gotcha. So I understand part of, outside of helping us understand a little more about the energy industry, there's also a member benefit tied to this. Is that true?
That is correct.
Why don't you share with us what that member benefit is?
Well, the new member benefit is the Energy Co-op program.
Okay.
And the nice thing about the Energy Co-op program is that it's unique compared to what everything else is out there. It works on the basis of aggregation pools. So we'll combine members' usage not only with members of this chamber, but 22 other chambers around the state. It gives us a lot of leverage, and then we go out on everybody's behalf and shop all the third-party providers and get a rate lower than what they can get on their own.
Gotcha. So, since the mid-90s, maybe 1,000 pieces of mail or telephone calls or emails, those combined, request or let me give you a quote on your energy. Is this one of those kinds of programs?
No, we don't go door to door. We don't send mail. We don't call on the phone. I mean, there's a lot of great companies that are out there. The difference with us is the aggregation of everybody's uses. That gives us that capability of getting the discounts that the large companies like Northrop Grumman and Walmart would attain.
Gotcha. Would you all have been with my current provider? Let's just say, for the listener, or for the folks watching Chamber Chat, I've been with my provider for years. I like their service. I like the budget billing that they offer me, no peaks and valleys. Am I a good candidate for this? Because I'm comfortable where I am.
And we want you to stay there. That's not going to change. The only thing that you have the capability of shopping around is the supply portion. Your default supplier who you're getting your bills from, you're still going to get the same bill. You're still going to be able to participate in budget billing and peak rewards. And if you have any challenges, you're still calling them. So nothing changes except for a lower rate. Gotcha.
So folks on the shore, I'm a come here, 13 years in. But it was like throwing Briar Rabbit in the briar patch. For the older viewers, you'll know what that means. The younger viewers will not. Being familiar is a plus here. I like doing business with people that I can look in the eye and shake their hand and see them around town. This new company, this CQI, why should I trust CQI and take that plunge?
Well, you have to understand that CQI has been working in this area. We work with the city of Salisbury for a number of years. Okay. We work throughout a lot of Ocean City and Berlin. Most of the municipalities, most of the school systems, the archdiocese, I can only say we're like the 7 degrees of Kevin Bacon. One way or another, you're probably already working with us. But we're here to provide information. Not every program, including ours, is perfect for everybody. So we're here to answer questions. We will actually provide a free savings analysis for them, no charge, no obligation. But we want them to feel comfortable and let them make the decision.
Gotcha. So in the analysis, typically, and I know it's different from person to person, right? From company to company even. What would the typical savings be and I don't even know if it's a good question to ask you, what would the typical savings be for a company that would work for CQI?
It's actually easy because this is both for residential and commercial.
Okay.
And the way it works is, and what we base it off of is historical data. You don't want to go with percentages because percentages can be deceiving. When you go with historical data, if you take your highest 1 month bill in the 12-month period, the entire bill, that's your minimum annual savings that you will see.
Okay.
So that'll vary from one person to another.
So that's typical savings, is that highest bill.
Correct.
You can think of as your savings.
Correct.
All right, cool. Well, right now, let's say my bills aren't bad. You know, we're coming out of summer and a lot of air conditioning going on, but let's say my bills aren't bad right now.
Right.
Let's call it October.
Okay.
Should I still take a look? My bills aren't bad now.
Well, you have to look at a couple things. You have to look at not only your present situation, but also your future. If you're looking for budget stability, then you want to analyze that. If you want to take into consideration that energy rates will fluctuate from month to month and year to year. Typically, summer is high and it's low in the wintertime.
Right.
But there's other factors other than the weather that plays into what the rates are going to be. Your terrorist attacks, geopolitical situations, the stock market, it goes on. And all these variables will determine what the rate's going to be. When you're with your default supplier, that rate's going to change month to month. When you're with a third-party supplier, that's a fixed rate. So you have a constant that has a better opportunity of giving you that budget stability from month to month, so you have a better idea of what your costs are going to be.
So you're telling me that since it's not October, and my family likes to be more comfortable than most, I would say. I think every person that pays the bill and the light bill in the house, husband or wife or whomever, has this same thought. My family likes to be much more comfortable than every other family in the summertime, so they crank the thermostat down a little bit. So what you're telling me, there are more things that affect the rate than just the weather.
Correct.
Back to your point of the geopolitics even.
Correct.
Gotcha.
The unfortunate terrorist attacks that we had overseas,
Sure.
that plays in a factor. If you look at the commodity on the stock market, your electricity, you can actually see the changes that occur with any kind of political incident. When we had the presidential campaign, you saw the fluctuation going on. So there's a lot of things that play into it. You talk about as far as the driving that AC down to keep it nice in the house, and that's great. You want to be comfortable. There are other things you can do around the house to help curb that increase. If you have a lamp that's in a room and it's just acting as a decoration, but you get it plugged in,
Gotcha.
Unplug it, because that's pulling electricity that you don't need to. And
So I don't have to divorce my entire family.
No, you do not.
Or they me, if it's because I'm as guilty as anyone. If it's cold, I want to be warm. If it's warm, I want to be cool.
You're just like everybody
That's
else.
right. Joe, who can participate in this co-op?
Anybody that has a home, an apartment, anybody's paying a utility bill, residential, commercial, doesn't matter.
Very good. Joe Tabeling, CQI, thanks for joining us on Chamber Chat.
Thank you.
We'd like to give you now an opportunity to take a look at the upcoming events with the Chamber of Commerce. Welcome back to Chamber Chat right here on PAC 14. Joining us now is no stranger to PAC 14, Chris Hall, VP of Strategy with PRMC. Welcome back.
Well, thanks, Tony. Glad to be here.
VP of Strategy. This day and time, I would, given the current environment for healthcare, I would think strategy is a little bit challenging.
It's definitely different. I grew up for 20-some years doing strategy one way, planning for hospital services, and now I think it's that and planning for wellness.
Is it more? I think the answer is in the question. Is it more difficult now?
It is. It's much more difficult. Before you focus on just providing healthcare services through a hospital, through the acute care world, and now we're trying to provide that and trying to make sure that people stay well, either from when they leave the hospital with a chronic condition or so they don't even come to the hospital to begin with.
At the risk of you doing so, give us a peek inside of your strategy process, because it has, to your point, it has to be much different than it was before.
And absolutely. Every day it seems something is completely different. I'll back up a little bit. In 1897, PRMC was established here in Salisbury. For 80-some years, it was always the hospital, moved from Fitzwater Street over to Carroll and 13. And since then, it continued to build the services. In the 70s, they added open hearts. We had a lot of clinical pioneer physicians and nurses, et cetera, that really stretched the envelope for the Eastern Shore, because a hospital like this really isn't found in rural areas.
Right.
So we continue to plan for those services, whether it be open heart, whether it be the first cath lab in the 70s, et cetera. So we continue to evolve. But now as we moved into the 2000s, it's completely changed. So we're continue to look at what needs the community for what should be in the hospital. But we also have to look outside. Where is it that's a cheaper setting for people to receive care at the same quality?
I know you've been on the show a couple of times, and I think in both instances you've talked about rebranding the H, if you will, in hospital to not mean hospital.
Yeah, if you think about it, you drive down the highway, you see the blue sign with the H in it, and everybody goes, okay, that's a hospital.
Right.
They know to go if they are sick.
Right.
But it's really now we're transforming that from just hospital to health. So especially in the state of Maryland, Maryland's a completely unique state. It's the only state that has a waiver or a demonstration project with CMS, which is the provider of Medicare and Medicaid services. And what they did is they capitated all hospitals. So before you used to charge a fee for every service that you would provide. Now what they did is they put it kind of like your parents. You're on a fixed income. Your rates are set, no more, no less. So our responsibility now is to work within that fixed amount of money. But the issue is we need to keep people healthier so that they're not coming into the hospital and to receive the services. However, I don't want to make it very clear we're still here and providing the highest quality. For instance, we just filed a certificate of need to look at child and adolescent psychiatric beds. So we're continuing to provide the services that the community needs, but we're going to focus outside the hospital as well.
Steve Leonard's going to take over in January.
He is.
I'm sure he's going to be watching Chamber Chat, so he's going to listen to this answer very closely. Any peek into his vision from your perspective?
Yeah, great example. In 2015, we created a new strategic plan called Vision 2020. We set out for the first 3 years into that process, so 15, 16, and 17. And that was that world of let's look outside the hospital. Let's see what else is out there.
We actually spoke about that on Chamber Chat.
We did last time, yeah.
That's right.
So a great example is we just partnered with Your Docs In. We made partnerships and created actually a wellness, weight loss and wellness center. We're providing a breast center where we took the one we had and a competing one with physicians and put it together. Just those examples are moving outside the hospital. Steve's vision, we're now in the process, really at this moment, we're working through a new strategic plan to update it for the next 3 years to get us to that 2020. So I think what you'll see is an evolution of the path that we've been on, may be accelerated, may change a little bit, but for the most part, we're heading towards that vision of the health and wellness provider on the Delmarva Peninsula.
You spoke a little bit about how Maryland is different, or you guys are being, hospitals in the state are being treated different. Is that every state, or is that just unique to Maryland?
Yeah, that's a great question. It's actually only Maryland. Maryland's the only state under this demonstration project. Delaware's only, for you, a driver distance away from here. So, they're under the regular world, the fee-for-service world, so they still negotiate with managed care companies. We don't. Fixed payment, whether you're a managed care HMO provider or if you're a Medicare or Medicaid patient, it doesn't matter. Everybody pays the same amount.
Well, lucky us, huh?
Every hospital in the state of Maryland's like that. We are all non-for-profits. There are no for-profits. There are no community hospitals. I mean, there's no public hospitals.
Gotcha. You spoke briefly just a minute ago about helping people in general be more healthy, population health. That is, I would think, in the rebrand of the Blue H has to be a big part of the strategy.
It is. Think about it this way. You go into the hospital, you had a cardiac issue. So you're taken care of, everything's good, and you're rebalanced, if you will, but you still have congestive heart failure. So you got to watch your weight gain, you got to watch the amount of water that you retain, et cetera. So what happens is when you get discharged, some people don't manage their health as well. They may go back to their old habits. They may not take their medication. What we do is, one small example, is we have a case manager that's embedded within the primary care offices. So if you're a patient of Dr. X, this care manager is with Dr. X, and therefore she will be calling you, or he or she will be calling you, following up on you to make sure, hey, Tony, did you weigh yourself today? Did you take your medication? So they're going to be managing you so you're not going back into the hospital.
Sure, I understand that. You guys have been doing that for years, haven't you?
There has been small parts of it. Yeah, we actually were one of the first ones on the shore with both cardiac rehab, with telemedicine for heart patients. So there's been a number of things we've done, but I would say now it's accentuated.
I think the probably the biggest piece of the solution, and also probably in many cases the biggest obstacle in healthcare, are your healthcare consumers,
Yeah, it's us.
patients. How do you see that playing into the role of healthcare?
I think you hit the nail on the head. That is one of the most significant challenges. It's us. It's
Sure.
how do we manage our own health? What
Right.
are our own habits? And a lot of it's going to be awareness, education. So if something does fail in your body and you do go to the hospital, how do we educate you so that you can do things differently so you don't have to come back?
Gotcha. You opened a new facility in Ocean Pines?
We are. It is actually a complete campus. It will be a hospital campus without inpatient beds. So we started out with family practice and pharmacy and cardiac rehab and lab, and now we're adding a brand new cancer center, which will open up next week.
Very nice. The last thing I want to make sure we touch on, you talked about a relationship with a local urgent care provider that we've probably all been to. Your Doc's In. Tell us how that came about. What's that all about, and how is it gonna help us?
PRMC has about 95,000 emergency room visits every year. About 1,500 traumas get flown in. So we know that's too many people coming in. A lot of it, about a third, really don't need to be in the emergency room.
Right.
So they should be taken care of elsewhere. But a lot of people use emergency room for their primary care
Sure.
because they can't get access to their doctor, or they just don't know where to go. So we knew that this episode of care is something that's needed for a lower level, and Your Doc's In was an established brand.
Sure.
They already have 5 centers across the Delmarva Peninsula, and so we partnered with them, knowing they're the experts. We're not the experts in urgent care. So that's what we look for, is somebody that can take the reins and run with it, and so we partnered on the first site across from Salisbury University.
Very good. I put you on the hot seat last time and asked you to pull out your crystal ball and look out 25 years. Let's do it again. 25 years from now, what do we look like?
I think what you're going to see is it's going to be as clear as the Mississippi Delta. Regardless of what side of the aisle you sit on in Washington, it doesn't matter. Healthcare has to change.
Sure.
It's 20% of the GDP for the healthcare sector, and it's one sector of the economy gets that high, it's unsustainable.
Sure.
I think we're heading in the right direction. I think taking the reins across the Delmarva Peninsula and making people stay healthy, stay well, is the right way to go. What it would look like, to be seen. I think you'll still continue to see more evolution outside of the 4 walls of the hospital.
Very good. Chris Hall, VP of Strategy with PRMC. Always welcome and always a pleasure.
Thanks, Tony. You too.
We'd like to give you another look now at the upcoming events with the Salisbury Area Chamber of Commerce. Hi, and welcome back to Chamber Chat right here on PAC 14. Joining us now is Dr. Eric Ofori, owner of Delmarva Kidney and Hypertension Specialist. Welcome to the program.
Thank you. Thank you.
Well, I think the name probably says it all, but there's probably a little more to it. But could you tell us what you do at Delmarva Kidney and Hypertension Specialist?
So what we do is take care of patients in the community with kidney disease and hypertension. So that's basically what we specialize in. Yeah.
So tell me what a practice like yours does. Is it treating those that are already there, preventative treatment? Tell me what your role is.
So the role is that, so most patients have primary care doctors, and they see their primary care doctor. And whenever their hypertension is not well controlled, their primary care doctor refers them to us as specialists to help control that. And people who have chronic kidney disease also are referred to us to manage the chronic kidney disease to prevent them from going into kidney failure. So that's basically it. Basically, the patients are referred to us by primary care doctors to help manage these issues. Yeah.
Gotcha.
Yeah.
So your accent is about as thick as my accent.
That's right.
So we're both come here's.
That's right.
But so tell us a little bit about your educational background. How did you land?
That's right.
Here.
That's right. So I've been here for the past 20 years.
Okay.
I went to college in New York City, actually, City College. Did biology. I graduated with biology and went to medical school in Syracuse, upstate New York.
Okay.
4 years, and then from there did residency in Robert Wood Johnson, New Jersey. After that, worked for a year and then went to Chicago, Northwestern, to specialize in kidney disease and hypertension.
It's like any doctor, man. You go through the official schooling and then it's residency, and you go work here and you go work here, and it literally is, quite impressive. After the schooling, all the training that has to be done.
I know there's a lot of training, but it's all fun. Fun training. Yes.
Well, it's fun for people like you. I would probably not do well. But let's dig into. Everybody knows what a kidney is.
That's right.
What is the role of the kidneys in your body?
Okay. The kidneys clears our body of the waste product. So we eat every day, and the food is broken down into good part and bad part. And then the bad part, most of the bad part is cleared out of our system by the kidney. We urinate it out. Yes, so that's basically the role of the kidney. It also controls blood pressure. Yeah, so clearing out the waste product from our body and controlling blood pressure.
Are there tests that can be done that can tell you if your kidneys are functioning properly?
That's right. Primary care doctor can do a lab test. We call it glomerular filtration rate for everybody to calculate how the kidneys are doing. Yeah, so there is a test that can be done. It takes into consideration the person's age, the gender, the race, but once the lab is done, the lab is able to calculate all these things and tell you what function your kidney is.
Are there symptoms of kidney disease?
That's right. Early kidney disease doesn't have any symptoms. So that's why it's important to see a primary care doctor. And then if there is a problem with uncontrolled hypertension or diabetes, they would refer you to us for uncontrolled hypertension. So the early kidney disease, people wouldn't have any symptoms at all. And we see a lot of patients who come in and then we tell them, unfortunately, you have kidney failure and you have to be on dialysis permanently, or you would need a kidney transplant. So our main role is to reduce the progression of the kidney disease into kidney failure. When somebody gets into kidney failure, the symptoms they will have will be decreased energy, nausea, vomiting, funny taste in the mouth, food not tasting right. Those are the symptoms that people have when their kidneys are completely gone. But the early part of it, people don't have any symptoms.
Wow. So there's kidney disease and then chronic kidney disease. What's the difference? What's chronic kidney disease?
Chronic kidney disease is any condition that reduces the function of the kidney. We talked about the kidney clearing the waste product out of our system. So any condition like diabetes or high blood pressure that reduces the level of kidney function permanently is what we call chronic kidney disease. And the way we would know about that is, again, checking the lab work, and then we would check we call it GFR, or glomerular filtration rate. And based on that number, we can assign the stage of kidney disease that the person has.
Gotcha. What are the risk factors, that go with kidney disease? That's
right. Age is very, very important. So the older we get, the higher our chances of getting kidney disease. Being African American is also a risk factor for kidney disease. Hispanics, Pacific Islanders is also a risk factor. Having diabetes and high blood pressure is also a risk factor for having kidney disease.
No, so that's a complete new one on me, which makes sense that you have a kidney center and hypertension center.
That's right, because the number one cause of kidney disease, 1 and 2, diabetes and high blood pressure. Other things can also cause it. So if somebody has diabetes, it's important for them to see their diabetes specialist to try and control it well, to prevent people from going into chronic kidney disease, and then kidney failure. Once we say kidney failure, it means that the kidney is not able to do what it's supposed to do. It means that you need support to clear out the waste product.
Are those the causes, the only causes of kidney disease?
Yes, there are so many causes. Medications can cause that, but the major ones that we need to know about, most important, is diabetes and high blood pressure. And controlling those would definitely help. Low salt intake would help with high blood pressure. So there are so many other causes of kidney disease.
So now you've just stepped over the line. You started preaching to me.
That's right.
Because you tell me to put down salt.
That's right.
And I love salt.
That's right. You know, salt is good for our body, but too much salt is not good for our body. In a 24-hour period, maybe a teaspoon of salt is what is recommended.
So like anything, within moderation, just about anything is okay within moderation.
That's right. And depending on how advanced the kidney disease is, or if somebody has heart failure, then we would actually reduce significantly the amount of salt they take.
I may have answered my own question.
That's right.
What are some ways to minimize or reduce the chance of chronic kidney disease?
The most important part is making sure you see your primary care doctor to get the lab work done. And then if you are diagnosed with high blood pressure, diabetes, following your doctor's instructions, trying to control the diabetes, trying to control the blood pressure, taking the medications that is needed. Other medications that can actually cause kidney problems are the non-steroidal anti-inflammatory medications like the Aleve, ibuprofen, Motrin. Those once in a while is okay to take, but if you take it over a long period of time, it causes kidney failure. So seeing the primary care doctor, following up with your specialist, and then taking your medications, controlling your blood pressure, controlling your diabetes, reducing salt intake are all some of the things that we can do to reduce our chances of having kidney disease.
Okay, I'm going to have to leave here and go to the gym.
Okay, yeah, I have to do the same too.
Okay, so tell me what's unique and maybe in some of the ways that Delmarva kidney and hypertension specialists approach your patient.
Yeah. So what is unique is that we take a patient-centered approach. Each patient is different. We look at the patient, we look at their background, their risk factors, and then just give the education and the necessary recommendations to their primary care to follow. We always make sure we are in touch with our patients, we're calling them back, and then just educating the community. That is the most important. Education is the most important part here, to let them know about this condition and how we can reduce the rate of progression.
Hopefully Chamber Chat will help you do just that.
Definitely, yes.
Dr. Ofori, thank you for joining us on Chamber Chat, and best of luck to you.
Thank you for letting me be here. Thank you.
Thank you. We'd like to thank you as well for joining us on this edition of Chamber Chat. And as always, if you missed a portion of this program or you'd like to view previous editions of Chamber Chat, you can utilize PAC 14's on demand feature, or you can visit the Chamber's website. That's about all the time we have for this edition of Chamber Chat. My name's Tony Nichols, your host, encouraging you to make a difference.